Now, we've been following the developments of the coronavirus vaccine. We've been talking about multiple companies applying for emergency use authorization. But when a vaccine is available, are Hoosiers ready to take one? Alan Carter reports.
Well, we can see the light at the end of this COVID tunnel. With effective vaccines, people are already fantasizing about normal. If, and this is a big if, everything goes according to plan. But of course, before a vaccine is here, we've already heard from many who say they just aren't sure. Just look on our Facebook page. Several people telling us they don't plan on taking a vaccine. And in a study from Pew Research in November, more than a third of U.S. adults said they definitely or probably won't take a COVID vaccine, citing concerns over safety. And that is the battle for public health officials. I did talk to local administrators, and they say making sure that people are comfortable is something that they're going to have to take on, although none of them commented on what kind of public awareness plan they have in the works. They are expecting some help nationally from the CDC to start a public education campaign. It is important to note that experts say while these vaccines came to the market fast, they still had to go through all the independent safety steps a normal vaccine would to get that emergency use authorization. A typical vaccine study may have 5,000 people. These trials had between 30 and 60,000. And there have been no serious adverse events like heart attacks or paralysis, just normal side effects that you would expect with most vaccines.
Now, some big names say they're ready to get the vaccine, hoping that others will follow suit. Former Presidents Barack Obama, Bill Clinton, and George W. Bush have offered to get vaccinated on camera. They say they want to show Americans that they can trust the science. Even President-elect Joe Biden says he'll also take the vaccine publicly because he wants to demonstrate its safety to the public. So where do the vaccines stand right now? There are two vaccines very close to market, one from Pfizer, the other from Moderna. Both have a more than 90% efficacy rate. Both use what is called messenger RNA. That's where the virus genetic code is injected into the body so it can instruct cells on what antibodies to produce. The Pfizer vaccine is already being sent to states ahead of expected FDA emergency use authorization. The number of vaccines sent depends on the population. The Moderna vaccine is also supposed to get that authorization by the FDA by the end of the month. Like the Pfizer vaccine, it also requires 2 doses. Both vaccines need to be kept cold before they're distributed. The Pfizer vaccine needs something that's called ultra-cold storage, meaning it needs to be kept between -70 and 80 degrees centigrade. The Moderna vaccine has to be kept in more of a regular freezer. We're told the vaccine could be here in Indiana in just a few weeks from now, and state health leaders have a distribution plan that is similar to what we're seeing around the country. The vaccine will go to healthcare workers first, first responders, and people in long-term care facilities for the first round. Then it'll be available to essential workers, then everyone else, and again, we're estimating that could be sometime around next summer. Now, meantime, in the UK, they're starting to vaccinate high-risk groups next week from 50 different hospital hubs. Right now, they have enough for 400,000 people in the UK. The Pfizer vaccine is a 2-dose shot. People will get the vaccine one day and a second full dose on day 21. Researchers say by day 28, full immunity from the coronavirus is reached. Meantime, in Russia, President Vladimir Putin ordered a large-scale COVID-19 immunization campaign to start as soon as next week. Doctors and teachers will be the first in line there to get this Russian-designed vaccine. It has yet to complete the advanced studies needed to ensure effectiveness and safety. Now, our Verify team has been getting so many questions about the vaccine, including the question, can you take both COVID-19 vaccines? Well, the answer experts say is it's just best to stick to just one. Our sources are Dr. Sam Sun and the CDC. They believe there won't be any benefit to getting both vaccines as opposed to receiving just one. And the reality is the demand for these vaccines is going to be really high. So getting just one vaccine could be difficult for many. Here is something else to consider. As we mentioned earlier, the Pfizer and the Moderna vaccines each require 2 doses. The CDC recommends that if you get the first dose from one company, it is best that your second dose comes from that company as well. And that wraps up our big story tonight. Remember, for most of us, we will not be able to get the vaccine for months to come, so there is time to think the decision over.